Welcome back to the second and last lecture to part 6, where we will be talking about the future of AI in medicine. Let's start by addressing the elephant in the room. So the impact of big for-profit companies on research, healthcare that involves AI. So inevitably, the comparison is with the pharma companies with the sale of drugs influencing, once again, healthcare, where there is a now very clear divide between healthcare delivery and the pharma companies. And the reason for that was the influence that these pharma companies were having on the delivery of care. So is it all bad? No, it's not all bad. And there are, good arguments for both sides. Inevitably, we need a driver in order to develop new drugs, new methodologies, new approaches. And money is a very big driver, and you just can't get away from that. If you think for that it's possible to have all of this drug development and discovery without the idea of profit, then sadly you are gravely mistaken, because it is just not possible to only fund research and drug development through let's say taxpayers' dollars. So meaning the government would pay for all of this research and then be quote unquote unbiased, right? It's just not possible. And so there needs to be a kind of healthy relationship between industry and academia. And that's actually what the government is currently encouraging. They want that. And so, applying AI to medicine, it's no different. There will be inevitably drivers, which will be like for-profit companies that are going to want to develop products that will be utilized in healthcare, that will benefit healthcare, but then of course will make their shareholders happy by profit. And so there has to be that, once again, a healthy relationship between the two. So what we'll just talk about quickly here is what are those, big companies. There's lots of companies, but let's talk about the big companies and what they're doing currently in the AI space in order to A, make their shareholders happy, and B, help healthcare. So Microsoft is the first one to come to mind. I'm not ranking them in any way. They are very good at implementing solutions and help and care, for healthcare, but namely for productivity, right? For enterprise solutions. And so no surprise, this is what they're doing here. One example is a partnership with Novartis, which is a bit large pharma company, where they're trying to, include AI tools for all of their research team, right? Now, they estimate that less than 5% of the world's AI professionals work in healthcare and non-for-profit organizations. And they also recently announced a 5-year, $40 million AI initiative to, once again, equip academics and non-for-profit research organizations, to help with their research. And of course, they're focusing on global health challenges inevitably, which is not a surprise. And also, their intent is to address this uneven distribution of data science expertise. And that just lends to what we've just talked about, that, it's not surprising that, where the money is where the data science expertise has naturally gravitated to. And what, Microsoft is trying to do is share it a little bit back to those areas of academia and non-for-profit. All right, how about Google? So, I love the expression, just Google that. So, the impact of Google is just enormous, right? It's no surprise that they are trying to do something in the healthcare space. But interestingly, though they are in this space, they haven't done that well. So let me explain. So first and foremost, their efforts date back easily to 2006. And this is where they attempted to create a huge repository of health records and data in order to help healthcare. So it's just a repository, and it was just ways to interact with it and to use it, and it failed. It just outright failed. So they stopped doing it. But that was their first attempt in Google Health. Now, since they've regrouped, and they've begun to reorganize since 2018, and now they have a fairly large team of 500 people working on it, led by David Feinberg. And what they're doing is they're trying to find new ways to contribute to healthcare. And so they've, of course, taken up artificial intelligence and the first ones not first ones, but one of the projects that they're looking at, of course, is analyzing imaging scans. No surprise. Another one is patient records, patient documents, and trying to predict outcomes from this, and inevitably as well to reduce costs, right? So efficiency. Now they have had other ideas that they're working on, which is, for instance, an option for people to search for medical information, in order to assist them in interacting with the healthcare system, which people already do, right? So, you have an appointment to see your physician and about a problem you have, let's say, toenail fungus, right? So what do? Well, you Google it, right? You just say Google toenail fungus, and boom, you're going to get like a whole bunch of information about toenail fungus and how you diagnose it and how it's treated and all that stuff. So when you show up to talk to your physician, you are better informed. Of course, the challenge is what is valid information. How do you parse through so much information you get? Those are the challenges, and most probably that's part of what Google is currently addressing. So the interesting part, as I said, that Google kind of faltered a little bit when they were addressing healthcare. I mean, is that a bad sign? No, not at all. It just means they were unlucky. They decided on a trajectory, and it didn't work out for them. Is that common? Yeah, absolutely. Would I say, oh, that's it, Google Health is done for, they're not going to be any, they're not going to be successful? Absolutely not. Google's massive, and they have like so much depth in knowledge of technology, especially AI. TensorFlow as a framework for AI is huge in imaging analysis. So don't write them out. I don't write them off. I really think they will definitely come out with something successful. All right, how about IBM Watson? So IBM Watson's a great story, but let me just summarize what they're doing now. So they're trying to make sense of the overwhelming amount of clinical data, medical literature, and other information in order to try and inform decisions, inform healthcare, right? They're also trying to provide contextual relevance, right? Because it can, AI can interpret like just billions and billions and billions of data points, and from diverse, different sources. And this will in itself help to identify what's relevant for whatever you're working with, for individual patients, for instance. And the other one is reducing fatigue, right? So reducing the ability for a human to go through all of that, literature and all that data would be exhausting, right? And so, can we make that process more efficient is what IBM is focusing on. And it's interesting that they went to this because when they got into the game of AI in healthcare, or big data in healthcare, they did so kind of in a big way. They spent like, over $1 billion jumping into the game. They purchased a company called Merge Healthcare, which is a PACS provider and an interoperability in the radiology space. Fantastic company, and they picked it up, and it was all great. And they thought, that's it. That's us. We're going to be the leaders in AI solutions through our PACS, and or the PACS was one of the mediums that they were going to use. And in my opinion, it didn't work out. They failed, right? And so what they did is they repivoted. So they not repivoted, they pivoted, right? Which means they changed their focus on what they were going to deliver, and it's working for them. So, and this is what I've just explained on this slide to you. They're basically looking at, helping in triage and helping and dealing with all this data and looking through all the data and making sense of all this data because they're really good at that. And IBM Watson is a tool that can definitely help do all of that. So what is IBM Watson? So it's essentially a very efficient analytical engine that can pull together diverse sources of data in real time and large quantities of it, looking to discover insights and to provide it to the user with a good level of confidence. Now, the software it used, for instance, for the Jeopardy competition, which the Jeopardy episode, and I'll talk about that in the next slide. It used was software called Deep QA, which was developed by IBM Research. No surprise. It runs on a cluster of huge amount of computers with 2,880 processing cores. Wow, right? And it's for its training, it was fed just absolutely huge amounts of data, and over years, right? So IBM Watson's claim to fame or kind of launch into the public sphere was when it participated in Jeopardy, and that was in 2011. And it was at that time, it was only the early form of machine learning and natural language processing at the time, right? Because you can imagine 2011, that was 9 years ago. But it did fantastic. It really did amazing. And just as a little note, the reason IBM Watson or IBM Watson was named after IBM's founder and first CEO, Thomas Watson. So that's where it came from. So interestingly, it won at Jeopardy, and that was a big deal, right? Because that was the first time, well, not the first time, but it was an impressive show of artificial intelligence up against humans. There was another occasion in IBM's history, and that was when another of their supercomputers, Deep Blue, won at chess against Garry Kasparov, who at the time was one of the leading or top chess masters of the world. And that was a big deal too, right? Because that was the first time an artificial entity beat a human at something that was like considered, wow, that's never going to happen. So we've just discussed three of the probably larger groups, companies that are addressing the application of AI in healthcare. Are there other companies? Yeah, who isn't, right? And so the ones to watch for is going to be Amazon, Apple, and Facebook. No surprise. Amazon, I mean, wow, because of the COVID-19 pandemic, Amazon has just become a Goliath, right? I mean, probably the biggest company in the world today in terms of revenue and profit and growth, just because everyone's using it now because you're shopping from home, right? So is Amazon going to be looking to apply AI in order to improve? Yes, definitely in their commercial application. Will they be looking to improve healthcare? Yeah, for sure, because they want to jump into the healthcare delivery space to us humans. How can they not only profit from, but improve the delivery of healthcare? So, for example, an easy one will be, for instance, drugs, right? So the delivery and the filling of prescriptions is something that Amazon is definitely very interested in doing because wouldn't that be convenient that you just log on to Amazon and say, oh, I got to renew my prescription, and you just boop, 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 you type it in, and it gets delivered to your door the next day, just like anything else, right? Wow. And so are they doing that? Absolutely. They are absolutely doing that. Have they started the delivery on that? No, but they're very close. And so that's just a company to watch for sure. Apple, no surprise, of course, a huge tech giant that's been up against Microsoft forever. They definitely are interested in. I think they're probably interested more in digital health, right, as opposed to the regulated quote unquote healthcare system. They're going to look to see what they can do with their phones and with, I'm sure they're going to include something like that in their augmented reality glasses that they're working on and coming out very soon with. That's the space I see them contributing to. And Facebook, no surprise. So Facebook is an interesting company. That's a company that wants to leverage their data, and they want to make money off leveraging the data. And they've been caught with their hand in the cookie jar a bunch of times, saying, oh, you shouldn't have been doing that with your data. So they're going to tread that line very carefully. But that's what they want to do, is work with their data. Do they have a presence in the AI space? Yeah, they have a fantastic framework called PyTorch, which is probably one of the most widely used frameworks for AI, especially for processing images. So yeah, keep an eye on them as well. So let's bring it back home a little bit, and we can talk a little bit about the RSNA. So the Radiological Society of North America, and what they've done. And so they've launched an imaging AI collaboration for COVID-19. Of course, that's going to morph into any future pandemic. And it's essentially an open source imaging database that's going to be hosted at the University of Chicago, of course, because the RSNA is hosted in Chicago. And it's going to be co-led by the American College of Radiology, and the American Association of Physicists in Medicine. And so this is just going to be a huge open source imaging database that will be made accessible to those researchers in COVID-19. Now, of course, what's cool about it, which I've already just alluded to in the previous slide, is that though it's COVID-19, that's the focus, and that's what we're going to be working on. I mean, it obviously has plans to expand, into the AI development, assisting other diseases that could crop up in the future. And so this idea of putting together a large pool of data, and more importantly, the network, I think, is going to be very, very helpful for promoting research in the future, because that's what we need. And you're gonna say, well, why is that? Why doesn't the silo approach work? Well, I mean, I'm not gonna discuss that. That'd be a whole course in itself. But the silo approach is really not. It's just not the way to go. And the reason, there's so many reasons for that. But primarily it's bias, right? Because you're going to be biased about the way the work you do, how you do it, what your interests are, or the data you have access to. And so minimizing bias, of course, and I'm a biostatistician, so of course that's important to me, is it's so important, right? And so by collaborating, you're going to minimize those biases, and you're going to improve generalizability, which is what you want to do. We are now the global village, so to speak, right? You're not just creating a solution for your province or your country. You're providing a solution you hope is going to be useful around the world. And in order to do that, you need these collaborative large projects where you have access to all of this data and knowledge, in my opinion, of course. So I'm going to stop there. I just wanted to talk a little bit about the direction and the future direction of AI in medicine. There's just so much more to talk about, and it's changing day by day. I'm going to have to update these slides practically weekly to keep up to date. And so that's why I tried to keep it kind of high level. And I doubt the large players are going to change all that much in the near future. Of course, there's just a huge quantity of smaller players that are all working on solutions and developing really cool, new methodologies that will be leveraged by whoever in the future. And that piece is is probably even more exciting than the big players. I really do believe at this point where we are in AI, knowledge and application, that it truly, who's moving us are the startups, are the small groups that are really digging in there and looking for innovative solutions. I think the big companies, they're great, of course, but are they the ones that are going to come out with the wow changes? I'm not sure. I'm not sure. I think they're going to be instrumental in providing tools and providing environment and providing support to find those really cool advances. But will all those advances be, all under IBM, Microsoft, Google, Facebook, Amazon? I don't think so. I think a lot of the cool advances are going to be in the small groups and then taken up by those larger companies. And I think that's the exciting space to be in. As if you're interested in jumping into this field, should you be just saying, oh, I just want to work at Google, or I only want to work, at Microsoft or IBM? No, I don't think so. I think if you have the desire, the drive in order to do cutting edge new stuff, I think you should be considering startups and working for startups where you are going to truly contribute, um, you know, uh, with less restrictions, if you wish, than if you were to sign up with a big company. That's what I would recommend. If you want the prestige and the salary and you're willing to plug in, you get play ping pong and, eat your lunch in the cafe in your own office, sure, yeah, go for the big company. But I just think in terms of freedom for you to express yourself in terms of the work you do, probably a smaller company would be the way to go, and it'd be more fun, in my opinion. In my opinion, of course. Anyway, there you go. That's actually also wraps up our course. I hope you enjoyed it, and hopefully I will see you out there in the AI and medicine world. Thanks.